Welcome, Dr. Nalini. I am so thrilled to have you here on the podcast. I love the work you do, and you've changed so many lives. And I just have to tell you, because I've had your book for many years, and I usually bring the book with me when I'm doing a podcast interview. But I realize I've given all the books that I own, which were they were, I think, three actually, to friends and people who've had cancer, because it's such a wonderful book. But thank you so much for being here.
Thank you for having me.
So before, there's so many, it's so important for this community of people who care about their bone health. And there's so many people here that are cancer survivors as well and have had issues with bone health because of that. But before we start, I wanted to ask you, because you have a certain premise that you take with you in terms of all the work you do. And that's that you create a body that cancer cannot survive or thrive in. So you want to just explain that concept, because I think that's so important, and it permeates a lot of your work.
Yes. So, what we really want to think about, really, with any serious illness, including cancer, is that we really need to understand the whole biosystem, the body that's hosting cancer. Why is our body a happy place for cancer to develop and thrive and persist? So, it's like the soil in a garden. If you change the soil, then you change what grows there. So, that's kind of a missing piece from oncology. And so we really need to have not only a good disease model to focus on understanding the cancer itself and what's driving it, but we need to understand the environment, the soil that it's growing in. And then if we transform that environment, which is really a signaling environment, we can change whether or not we're sending growth signals or stop signals to cancer cells. And so we really want, for the long term and the big picture, to not have a good host for cancer. So we need to create a body where cancer cannot thrive. And so that's really the premise. And there are many, many factors that go into an environment that is a place where cancer can root and grow and persist. And so we address many factors so that we actually do a more comprehensive job of looking at the patient than the oncologist does. And so by combining the best of both worlds, you really get the best outcomes and results. But then when the oncologist is done with you really need a long-term plan to not have a recurrence. Or if you have a lot of cancer in your family, then you need to have a good prevention plan that is really broad, has breadth and depth to it, so that you address all of the factors. And so that's really what we call our OutSmart cancer system.
And what I love is that, sometimes people feel helpless, that, oh, what can I do? Is it going to come back? And they don't realize that there's so much
Yeah,
that can
yeah,
be done in
yeah,
so many
yeah.
areas. And the other thing I sometimes look at, not that we look at cancer as a blessing in disguise, but oftentimes when then you address all of these other factors that can prevent it, your life gets better because it improves your overall health as well. Have you
Well,
seen that too?
it's a paradoxical thing, but many people say cancer is the best thing that ever happened to me because, in fact, it transforms their life. It is a great gateway in anyone's life, and it's an opportunity to reflect on your core values, what's important to you, your relationships, your work, how you spend your time. And so when you face your mortality, it really, you get real. You get very, very real. And that is an opportunity to make changes. And at the same time, the oncology environment, the conventional oncology environment, is one in which the patient is disempowered and disenfranchised. And so it's very important. I always say to patients, you need a team, you need your health experts and your disease experts, but you are the head of the team. Your oncologist doesn't own your body or your schedule or your decisions. And so it's very important to take back that sense of agency and that sense of control so that you can own the trajectory of your cancer journey and what happens after your oncologist is done with you, which is a very stressful moment. You've had a lot of contact with your care providers for a long time, and then all of a sudden they say, bye, we hope you don't get a recurrence. And then you're sort of like, now what, right? So it's very important to have a plan so that that anxiety doesn't overtake you, because all cancer survivors have a fear of recurrence, and they'll always live with that. So it's important to know that you're doing things that are really going to make a difference.
That's so important because there's nothing worse than feeling disempowered. And I know, so often the very first thing that happens, and I actually teach a happiness program, is that people say, "Oh, poor me," and you feel like the victim. And that just unfortunately doesn't really get you anywhere. And when you're disempowered, that also happens. So working with being in charge and having this team supporting you, but then you're focusing on solutions and you have a plan, just like you said. So I love that. And I just think what you do helps people so much because when you're empowered, you can make the necessary changes to improve, really, as we said, every aspect of your life. So now I want to focus on the bones because there's such a connection. So, what are the unique concerns regarding bone health that both people who are going through cancer and survivors of cancer have that we need to really deal with?
Well, there's quite a number of things. First of all, if you just think about the age demographic of cancer patients, it's mostly people over 50. Unfortunately, because of our very toxic environment, we're seeing younger people be diagnosed with cancer. I have many more people in their 30s and 40s in my practice now than I used to.
Mm.
But really, the statistics are that as we age, because we've lived on the planet long enough and we've been exposed to multiple environmental stressors and life, that our immune system ages with us. And so we are less able to solve problems and challenges in our bodies as we age. And so most cancer diagnoses occur over the age of 50, which is also the age where women are going through menopause, and also men have bone loss as they age as well. So the bones become less dense and more porous, and so they can be more easily invaded by cancer cells.